Bonjour à tous, and thank you very much for this opportunity to present this study which we performed during my fellowship here recently in La Croix Hospital. I'd like to acknowledge the co-authors who worked with me on this study. So I have no disclosures. So we've heard that there are a lot of ways to perform MPFL reconstruction, and actually they've largely got good short to medium term outcomes, but really when we look for long-term outcomes in skeletally mature patients, there's actually a paucity of data on this. So this just had a very simple aim, this study, was to look at what the outcomes were of the long-term outcomes of MPFL reconstruction when it was performed as an isolated procedure. So this study was performed at La Croix Hospital here in Lyon, as I mentioned. We were looking at patients that had this surgery performed between 2006 and 2011, and we excluded the patients that had additional procedures, including a lateral release. So we had 70 patients that were eligible for a minimum of 10 years follow-up, and we had one patient who passed away, 15 we couldn't find. So we had 54 patients to analyse. 4 of them had to undergo revision surgery for repeat instability, and I'll look at the outcomes of the 50 remaining patients. So just to quickly go through the inclusion criteria, so what's necessary for patients to be selected for an isolated MPFL reconstruction here at La Croix Hospital? The patients can't have high-grade trochlear dysplasia with patellar maltracking. The TTDG has to be less than 20 millimetres and the Caton-Duchon index less than 1.4. The surgery, it's been described already, but basically you take the gracilis tendon autograft, it's stripped, split into 2 ends, whip-stitched with a vicryl suture, and there's 2 medial-sided drill holes in the patella in the superior 2/3, and it's stitched back onto itself at about 30 degrees of flexion. This is fixed on the femoral side using interference fixation. So we looked at the patients in terms of clinical assessment, patient-reported outcome measures, complications, and also radiographic outcomes. We were specifically looking at the Iwano grade of patellofemoral arthritis, which is graded from 1 to 4. I won't go through the grades. And these are our results. So for the entire cohort, we had the average, and 54 patients, the average age of 25, and all of the patients in this cohort actually had some degree of trochlear dysplasia. The average follow-up was quite long, so we had an average follow-up of 13 years, minimum of 10 and a highest of 14.8 years, so a very long follow-up in this group of patients. So excluding the 4 patients that underwent revision surgery, we then had 50 patients to look at the outcomes on, and most of them did quite well. We had an average IKDC score of 78, the average Tegner score was 4, and the average Caton-Duchon post-operatively was 1.01. So the Kajala score on average was quite good as well. Interestingly, we had 2/3 of patients have some degree of patellofemoral arthritis on their imaging at 10 years follow-up. So you can see here this patient, this is 10 years after MPFL reconstruction, it's an isolated procedure. You can see that that joint space is nicely preserved. There's no evidence of patellofemoral arthritis. And this patient here, you can see similarly 10 years down the track from their isolated MPFL reconstruction, and there's narrowing of the medial patellofemoral joint space, and there's some beaking and some osteophyte formation there. So we were interested in these patients, and we thought, I wonder if we can predict whether whether they're going to do well or not. And we broke patients into 2 groups. Kajala score of greater than 80 is seen here in green, and those less than 80 seen here in orange. And we tried to see whether or not there was anything that could predict whether or not they were going to do well. So we looked at all these things here, and actually the only 2 things that statistically significantly correlated with a better Kajala score was a better Tegner score and a better IKDC score, which is really self-explanatory. So all of these other factors that we looked at really didn't reach statistical significance, so we couldn't actually predict whether they were going to do better or not. We then looked at the grades of patellofemoral arthritis. So the green patients here have got no patellofemoral arthritis. Those in orange have got grade 1, and those in red have got grade 2. And you can see that there's a fairly self-explanatory step-off in the patient-reported outcome measures as the patellofemoral arthritis worsens. Interestingly, and probably owing to the fact that we had a very small number of patients in this study, only 50 patients, but they didn't reach statistical significance, but the results speak for themselves. So no patellofemoral arthritis did better than those with patellofemoral arthritis. When we looked at the literature, for skeletally mature patients, this is definitely the longest published series of data that we could find in terms of follow-up for skeletally mature patients with this procedure. It's not the largest series of patients though, but it is comparable to other studies. And the patient-reported outcome measures are comparable to other results in the literature. So interestingly, the results don't seem to degrade too much over time. And we did find that 1/3 of our patients had patellofemoral arthritis, and 2 other studies have reported similar findings to this previously. So what can we say? Well, it's long follow-up. About 2/3 of patients will have an excellent Kajala score. About 1/3 will develop patellofemoral arthritis. There's a 7% recurrence rate. And really, I think we need to probably think about why this is occurring, whether it's the surgery or whether it's actually the original injury that causes this to occur. So in conclusion, isolated MPFL reconstruction using a gracilis tendon autograft, it's a good procedure. It's got good long-term outcomes. And 1/3 of patients will exhibit some form of patellofemoral arthritis, at least radiographically at 10 years. Our results have recently been published in Arthroscopy if you want to have a look, and thank you very much for listening.